Good morning. Welcome to the Seed to Strength podcast.
Yeah, welcome. For those of you newly tuning in, I'm Jason,
I'm Hannah.
and we are both martial artists, both lifelong, and I started my journey in martial arts a little bit later than you did. And if you want to know more about that, then tune into episode 1. We talk about our backgrounds a little bit in the martial arts.
Yeah, absolutely. And for those of you that were tuned in this last week, I did manage to find some pictures from my Taekwondo days.
Oh, nice.
From when I was young. So bear with us.
I'm gonna fix this curtain real quick.
Bear with us as I put images up because I haven't quite figured it out. So hopefully it comes up right. Okay, so there is the family. There's myself as a black belt. That was when I had my junior black belt. And that was also when I had my junior black belt. That was probably the youngest picture that I had. So those were those pictures are definitely, gosh, maybe 15 years old or something. And I know you just missed them. So
Yeah, that's okay. I can't figure out the current situation, so.
That's okay.
But it's all good.
But yeah, so I was just going through pictures and kind of reminiscing, and in our studio setup, I guess our little home gym studio setup, I have my mom's competition uniform hung up. I never got to wear it for any competitions.
Mm-hmm.
It was my mom's competition uniform, and my black belt just kind of hung up on the wall.
Sick.
In there.
Yeah, and then we have a multitude of belts from the kids too. The way that the MMA dojo works, that we train and coach at, is the belt system is it's its own belt system. So we have white belt, and then yellow, and then orange, purple, blue, green, brown, and then black. So we have our own little belt system that my sensei has created. I think it's kind of like a karate based belt system, but not fully. Like it's his own.
It's kind of its own thing. Yeah, that makes sense.
So just like jiu-jitsu has its different system of belts, and like there's different martial arts that have their different systems of belts.
We definitely had our own system, and we had a little ninja system too, where it's like the whole belt system was like a white belt, but there was a colored stripe that went vertically down the belt.
Okay.
And so like that's what distinguished the little kids from the big mat. So like you'd make your way through little ninjas, and then you would enter with a solid yellow belt.
Nice.
Instead of your striped one. And then you got a stripe. I think there was like a multitude of stripes. It's like that far down your belt.
Yeah.
You had stripes.
And the way we do it with the kids is we give them 4 stripes before they get their next belt. And each stripe is going to mean something, right? So, and at our dojo, which is somewhat uncommon among the dojos, is we don't just give out the white belts. Because a lot of times, like, you first go into a dojo and you get your white belt. Like that's that's just given to you. And there's in the jiu-jitsu community, there's a thing about like people tend to quit after blue belt. Like sometimes, for a majority of people like are gonna quit after blue belt, and the reasoning behind that might be the fact that you're given your white belt. Blue belt's the first thing that you actually earn, and sometimes people are just okay with that. They're just like, all right, cool, I earned it, and like I'll go do something else now.
Yeah, exactly.
And so we have the system where we make our kids earn their white belts. We're like, okay, well, we need you to show that you're going to be, serious about this, and you're going to have to earn that belt. It's not nothing in life is ever going to be given to you. And I think that's the lesson that we're trying to show them. It's just like, no, you got to earn it through hard work and like dedication.
Yeah.
You know, and then of course, like the belt system, we treat each belt differently. Like white belts are going to be treated differently than the yellows, and then the orange and the purples, and you know the next colors up. And we have a rule where we're not allowed to submit the white belts. Like the kids, like the higher belt ranking kids aren't allowed to submit any of the other white belts. And then it's really gonna be a difference too, because you might have a small little 5-year-old just starting, getting their white belt, and then you could have like a 15-year-old coming in and getting their white belt. We're gonna treat the 15-year-old a little bit differently than we treat the 5-year-old.
Yeah.
Like, no better, no worse.
Just a little bit different, because a 15-year-old's going to be able to conceptualize things a little bit differently than a 5-year-old would.
Yeah. So, and then even amongst like the 15-year-olds, like everyone's going to be different. Everyone's going to have a different affinity for different things, and whatnot. Oh yeah, and I did this on the other podcast, but just real quick, I also wanted to apologize on this podcast because we kept putting our cups down, or at least I did, and it kept like jolting the mic. Yeah. And I didn't realize that it did that until I listened to the podcast over again. So
I probably just did it. I was like trying to be mindful, because we filmed 2 podcasts in the same day. We film our Seed to Sprout podcast. It's our homesteading, gardening, baking, self-sufficiency, yapping, you know, all of the science, spirituality, crafts. We go into a lot on that podcast as well, but we filmed both of them on the same day.
Yeah, and so we did that last time. We're just putting the cups down. It's all ding ding because this mic is just real sensitive. But I wanted to throw that out there, just in case, like, you know, we just so the audience knows that like we've learned.
We're working on it.
We've captured our mistakes.
This is it's brand new to us.
Yeah.
So we're learning, and like I said on the last podcast too, I have a history using like the software, the OBS, and the equipment and the interface and stuff like that, because I used to stream music. So I had a little bit of a background, but podcasting is brand new to both of us.
Yes.
Just one moment. And so we do these podcasts at home. Obviously, we don't have any special studio, but we do have a Christmas tree in our bedroom. And we do have kids. So it's a very family-friendly podcast, both of them.
Yeah.
Every once in a while, the kids might actually join us. They both do martial arts as well. So they've kind of been excited to join in on the podcasting, and they've been in your recent video as well, like on the Seed to Strength.
I was gonna say, yeah.
Instagram.
And like YouTube and stuff like that. So like any of the links that are up there, the YouTube's not up there, but it's under the same name. So we did a throw by video. This was a wrestling technique, and I asked the kids if they wanted to join, if they wanted to help, and they were like stoked on helping. And one of the things, and so now they kind of want to like create their own and stuff like that. And as far as their belt levels, they're on 2 totally different levels, because Aiden started a lot earlier than Rhiannon did. So our son started earlier than our daughter. And he was about 3 when he started, and I talked about it on the last podcast too. He was closer to 4, but he was like, 3 3/4 or whatever. And so he's on his way to earning his brown belt with our dojo now, and part of that journey is he has to teach a class. He doesn't have to teach the whole class. He's 9 years old, so like it would be different than someone maybe like 17 or 16 getting their brown belt.
Yeah, they'd probably have more responsibility in teaching, right?
Yeah, they would just have like they'd be able to kind of teach the entire class. They'd be able to take the lead. So what Aiden does is he's like a junior assistant coach on his way to the brown belt. So he does the warm ups and the stretches, um, animal drills, and then whatever technique that we teach, he walks around and helps. So the way that it usually gets split up is we have three coaches, um, three main coaches. It would be Sensei, who owns the dojo, and then me, and then Brendan. And the way that it usually works is Sensei usually takes the strikers or the people that are going to fight, like compete in kickboxing or boxing and whatnot. Brendan either usually takes the strikers or he takes the white belts and teaches them white belt technique, trap and roll, shrimp escape, um, you know, and things like that. Even sometimes going into some like super basic submissions. And then I'll usually take the advanced belts and the competitive grapplers. And the reason for that is because Brendan he's an active MMA fighter, and he is really good on the feet, and he's really good on the ground too. Um, as far as competition experience goes, though, he has more competition in MMA and like Muay Thai kickboxing, and I have more competition experience in jiu-jitsu competitions and coaching the kids in jiu-jitsu competitions and things like that, sitting in the coach's chair yelling out things to do. And like and I'm not saying he doesn't, but like I understand, like, very minute details
It's
about, grip here, or use this grip, to do this move. This grip is better. This grip might be the best. Like, it just depends on the move, and even just placement of the hand. It's like, okay, well, you don't want to grab here. You want to grab here. Like, it makes it so much easier.
yeah, it's a very harmonious situation that you get at the dojo because everybody's in their more comfortable areas. It's not just more comfortable, but it's their areas of interest. Like your area
Yeah.
of interest is going to be grappling. Like it excites you.
More so, yeah.
And then Brennan's area, that's what excites him. Sensei's area,
Mm-hmm.
which is straight across the board, but really you see him light up just as much as the kids do when he's working with the ones that are getting ready to do kickboxing fights and stuff.
Yeah.
He gets that fire in him too. You can see
Well,
it in each one of the coaches that you're exactly where you want to be.
and the cool thing is that everybody's going to have a different coaching style, and everybody's going to be able to reach the kids equally but differently.
Yeah.
Like, it's just in a separate way. And what I was alluding to when I was even mentioning that was the fact that, like, sometimes Aiden will go with me and
Mm-hmm.
he'll help me coach, or sometimes he'll go with Brendan, or sometimes he'll go with Sensei. Like, it's just wherever he's needed, basically, he's going to help
Yeah.
coach. And even the you, you can learn from anybody. There's a whole choke called the 7-year-old choke, because it's just some random choke that some 7-year-old figured out how to do. At least, like, that's my, I never really looked into like the history of it, but that's my understanding, is that that's why it's called the 7-year-old choke.
That's funny.
Because it was just like some random 7-year-old that figured out like how to do it. And so you can learn anything from anybody.
Yeah,
um,
absolutely.
and like, even, because I think like maybe sometimes like some of the kids might it's harder to take a coach that's your age when you're a kid seriously,
Absolutely.
and like it's easy for me, like I'm 34 years old, and if I have a coach that's 34 years old, I'm gonna take him seriously, you
Yeah.
know. but when you're a kid, it's just like
it's different.
it's a
That's
lot
your
different.
homie.
Yeah.
You know.
So, but he's gotten really good. Like he started using like a stronger voice, and he started like being able to like help teach the techniques and stuff like that. And what I was getting to was like yeah, you can learn something from anybody, no, regardless of like how old they are or you know what their skill level is or something like that. Everybody knows something that you don't know,
Absolutely.
you know. And even we were teaching arm triangles the other day, and these kids like everyone was getting it except for these two kids. And Aiden's walking around, he's looking at it, he's checking it out, and I couldn't figure it out. I had them do the arm triangle on me because I was like, yeah, it looks right, like everything looks fine. And then I had them do it on me, and it worked. And I was just like, no, that's tight. Like, why isn't it working on each other? Like, it was kind of weird. And then Aiden noticed that like the positioning of the arm was slightly off for the person being choked. And then as soon as like they made that adjustment, they were able to finish the choke, both of them.
Okay, good.
So he figured something out that I couldn't even figure out after I was walking around looking at him like, why isn't this working? Like,
he picked up on it.
yeah.
Oh, that's really cool.
So it is super cool, and you know, so they've been at it for a while. Rhiannon is a one stripe yellow belt, I believe, like one or two stripes. But when you get the stripes, like we were talking about before, like they all mean something. So like in your white belt, like your first stripe is, you know, you have to be able to do the punches and kicks. You know, the second stripe, you have to be able to do the ground game. Third stripe is you have to be able to be strong. You have to be able to do the push-ups and the sit-ups and the jumping jacks and all that other stuff. And then the fourth stripe, and the one that we stress the most, is you have to be a good person. You do not get that stripe if you are like a bully, or you know you're not listening at home, or you know things like that, because the
Yeah.
entire idea behind the martial arts is to build discipline and to build people that are disciplined,
Yeah.
and especially when it comes to the kids.
Absolutely. I think that there's a lot of kids that you see in martial arts, and their parents signed them up for that reason. Above anything else is just learning discipline. And there's something about learning discipline from martial arts that's very different from just learning it at home. You can have an amazing parenting style to be really good with discipline in the home place, but there's just something different about the discipline that you get from martial arts. It makes you a stronger human being.
Well, and I think part of it is the perspective from the kids to the parents and the kids to the coaches, because I don't know if you've noticed, but like there's a difference. Like the kids, all three of them, like Aiden, Rhiannon, our son and our daughter, and then even Daniel, who is our nephew, they treat me as a coach in the gym, and then they treat me as like a father outside of the gym. But and there's respect aspect on both sides, but it's different, you know. Like they kind of know that like when we're at the gym, we're there to work, and yes, we're there to have fun, but we're there to concentrate, we're there to be serious, and we're not there to like goof around too much. And then we come home and it's like nothing but goofing around all the time.
Absolutely, monkey business, 100%.
So
and honestly, that concept that Rhiannon has with you, because we do homeschooling with Rhiannon, like a virtual school, and she has a lot of difficulty in accepting me as teacher and mom. You know, she'll want to talk to me and ask for things that you wouldn't ask for in a school setting. You know, like there was a story prompt that I gave her, and she was like, "Can I have a different one?" And I was like, "Rhiannon, if I were to have a classroom full of children, not just you, and I put a writing prompt on the board, would you go,
I'm not
can
like
I
that."
just have a different one? Or would you do the same one that your classmates were doing? And she's like, that's a really good point. So then I talked to her and I was like, listen, like, you understand how Jason is dad at home, but he's coach on the mat. She was like, yeah. And I was like, and you don't have a hard time with that concept at all because it's a different location. You know, we're still at home, which makes it harder for me to, harder for her to see me in different roles. So it's like, but I need you to think about it like that. Like, when we are doing schoolwork, my hat is different. The hat I'm wearing is teacher hat. It's like, if we're at the gym, the hat that I'm wearing is coach hat, and you got to listen to me like I'm your coach and not your mom. And that one took her a while too, but less than school. You know, the first few times that we went to the gym together, I had to like threaten to wait until she was older a few times.
Yeah.
Because she would get argumentative about certain things, about her form and stuff like that. She'd say, oh no, I'm doing it just fine, if I would try to correct her form. So then I had to kind of remind her, like, wait a minute, I'm not mom in here.
Yeah.
I'm a coach, and the coach can kick you out of the gym, you know?
Yeah. Well,
So, and she gathered that eventually, especially when we started going to the gym as a family. That's when it really turned around, is when it became a family activity for us to go lift.
Yeah. Yeah, no, absolutely. And then one of the things that I try to do as a coach is, you know, a lot of times, like, if you're the coach, or you're the coach's kid, or you're the teacher's kid, you either get it too hard, or you get it too easy. And I try to make it a point to where I treat everyone exactly the same. I mean, a lot of times, like, me and you have like, I talk to you the same way I talk to the kids. Like, I don't talk to the kids in a different way than I talk to you. I don't talk to you a different way than I talk to my boss. I don't talk to my boss a different way than I talk to the people cleaning the building. You know, like, I try to, like, treat everyone exactly the same and with the same amount of respect and things like that. And it's the same thing at the dojo, because it's like, I'm not just here to teach, because I take my coaching, like, very seriously, but I take it seriously because, like, yes, I'm there to teach technique, and I'm there to teach hard work, and I'm there to teach all that stuff, but, like, ultimately, like, I'm there to teach them to be good people. I'm there to teach the kids how to be good people. I'm there to even, like, you know, teach the adults how to defend themselves, you know, and stuff like that. But all of that comes from just being, like, a good person. And I don't want to just go and teach the technique, you know, and stuff like that, because you can be really, really talented, but if you're not a good person, and you're not, like, growing up to be a good person, then I feel as though, like, you know, I'm failing as a coach, because I'm trying to help raise a generation of martial artists, but not a generation of fighters per se. Martial artists first, fighters second, but, you know, you can, if you are going to be a fighter, there's ways to sell yourself and brand yourself without, like, just, you know, hitting just below the belt.
Jerk. Yeah.
So, and part of me understands the psychological warfare, you know, getting in people's heads and things like that. I do it a lot, like, when we're grappling, like, you just hit the mat yesterday, and I wasn't getting in your head in, like, a jerkish way. I was just, like, messing around, and
There's that one point you did, like, a shuffle.
Oh yeah, no, I always do that. I was like, I was pretending to play basketball. I kind of, like, I guess I might have ripped this off a little bit from, like, Sean O'Malley, but there's footage that we took yesterday, and I was just, like, pretending to do, like, the you know, dribble the ball, like, beneath the legs and all that stuff, and then shoot the 3-pointer, and then, like, right when I did it, I shot for your legs to try.
Yeah, so there is a lot of footage. I had a major milestone yesterday. Got on the mat for the first time since, what do you think, like,
sometime
June?
Earlier this year.
June, maybe? I don't know.
It might have been even before that.
It could have been earlier.
I think the last time you were on the mat was before the kids went
Then
for the summer, so like April or May.
it would have been April or May then.
Uh-huh.
So it was a pretty major milestone to get on the mat, but we got tons of footage. I just kind of set up the tripod with the phone and got a lot of what we were doing. So you're going to have to keep an eye out for at least a short, it probably won't be a whole long video, but a short of all of his shenanigans because we caught so many of them of just him messing with me. There's probably some of you messing with Francisco too.
Oh yeah, no, there is.
He was like slapping at each other.
I slapped him in the thigh, and then like we always just like, because he saw the throw by video, and he was like, I saw your video, and so I'm not gonna collar tie up on you. And I was just like, but you should, because like I need to practice it. And then I need to get good at the throw by, because it's a really good technique, and I haven't like practiced it a lot, so I want to get good at it. But yeah, we were just like constantly like going head to head. Like, instead of normally, like when you start a jiu-jitsu match, like you're gonna start with like a collar tie, so it's a hand around the neck, and then hand either the back of the tricep or grabbing the wrist, like a wrist control. And me and Francisco were doing none of that yesterday. We were just like, as soon as we started, we would just smash each other's foreheads, and then we would just like put pressure, just head pressure against each other. We wouldn't even like use our hands or anything. And but yeah, so it was really fun, because it's been a while since you've been on the mats, and we didn't quite know like what to expect, so we made it more like a flow roll, than I was even flow rolling with Francisco. Sometimes we go hard, and sometimes we just do a flow. Like, it just depends on what we're doing. Even just like the energy level of the class. Like, yesterday was more like a chill class, because it was like me and you. There's only 4 people there.
Yeah, we actually have some footage. My black belt pictures are gonna come up again. I just know it. Yeah. So.
Oh, I've seen that. Yeah.
Oh yeah, you can see these ones real quick before I change it.
Well, it's okay. I have seen these pictures though.
Oh, here's our.
Nice.
Okay, I think that's last. But then here's our grappling footage, or some of our grappling footage. We got so much. You can tell how much fun we're having. What should be frustrating for me was just the fact that there was just nothing that I can do, and it's what we're talking about, the white belt hell is. Anytime I get on the mat and do any grappling, like, it's just gonna be quote unquote frustrating. I have fun with it. I think it's challenging, but to the point that I'm just laughing because I'm just absolutely out of control. There's no control that I have in grappling at all. And I used to have a little bit when I was grappling you, months and months ago, but see, my health kind of went down the drain a little bit, and we'll talk more about that in a second. So my health kind of kept me from being active, and during that same time, I was like writing you plans for the gym on days that you didn't have the dojo. So you've been hitting the gym at least twice a week for a good while, and it's been strength focused, and the focus has been strength that backs up jiu-jitsu, like your grappling. And so after all that time, I before at least had some strength, so I was able to do like a little bit here and there. What was it, that shirt that we saw? It was all strength, no technique.
Yeah.
And it's been me.
Saw that at the super fight.
It's me 100%. I don't have any technique yet, but I did a lot of.
That was graceful.
I did a lot of weightlifting. The dog came through. I did a lot of weightlifting. So I've had a lot of 10 years of strength training under my belt. So when I'm not in flare up, I've got a good bit of strength behind me, but you caught up big time. There's a huge difference in your strength. It does make a difference in jiu-jitsu.
And I've learned a lot, because that's a whole, let's say you didn't get on since April that's a whole like 6 or 7 months.
Yeah, absolutely.
So that's consistent. It wasn't 6 or 7 months of consistent strength training for me, but at least like a couple months consistent strength training. But it was 6 or 7 months of consistent MMA sparring and jiu-jitsu training and preparing either myself or kids for competition, helping Brendan get ready for his title fight and things like that.
Well, and you're constantly looking at improving. You're always looking at jiu-jitsu videos to see what else you can learn, what else you can teach other people.
Yeah.
So there's a constant improvement happening.
Well, and that's the thing about being a coach too, right? Is like if you want to be an effective coach, like you have to be an effective student because you have to answer the questions now. You don't just get to ask the questions and be done with it. Like people will ask you questions and you'll have to figure out like what the answer is.
Yeah.
And it teaches you a lot of like just figuring out how body mechanics work, because different submissions are going to use different body mechanics and different escapes and different forms of like positional control and stuff like that. And just knowing where to exert pressure and knowing how to get pressure unexerted off of you and things like that. There's a whole component to coaching that is just consistent with continuous
learning more and then mastering it. You can't just like read it or watch a video once and then teach it. It's like you have to master it first before you can teach it, so it makes you like the best kind of student. That's how I try to teach Rhiannon where that line is in homeschooling, even, is just, okay, if you feel confident enough to teach someone else this information, then you know that you've really learned it.
Yeah. Yeah, no, absolutely. So it was a good experience. And did you want to talk about why you had to take the time off?
Yeah, so I guess the best way to go into that would be to start from the beginning. And I guess this is going to be more of a vulnerable moment because I've had a lot of struggles in my life when it came to my health. And that started from a really young age. And there's a lot that I did to rebel against the idea that I was going to be chronically ill my whole life. And I started getting pain. I think chronic pain was the first thing. Well, I guess migraines would really be the first thing that creeped in, and that was when I was in 6th grade, was when I had my first migraine. And when I say migraine, I really mean migraine. I mean, like, at that time I was just going blind. Going blind in one eye, losing the ability to speak for a little while, like mixing up words.
You'd be in
fatigue.
Bed for like 2 weeks. I mean, obviously I didn't know you back in 6th grade, but man, you'd be, whenever you're dealing with migraines, whenever we first started dating, like you'd be in bed solid for like 2 weeks, coming out to eat, just all the blinds closed, all the lights off, just ice pack on the head.
Yeah.
I'd go to your house and then I would just go in your room and it's just like, yeah, it was crazy, man.
And see, that kind of life for me started the second that I hit puberty. And migraines were just a consistent thing in my life from that point until just a few months after we moved in together, which is another interesting point. There's a lot of theories that I have on that, but so it started with migraines when I was a 6th grader. And then from that point on, I started slowly getting chronic pain. And I remember having some back pain as a kid, especially like between my shoulder blades, but it started to get to the point that it was affecting my day-to-day life.
Yeah.
And they had no explanation. Like, they thought that maybe I had just tweaked it somehow. They put me on Flexerol as a teenager. I was like on these muscle relaxers, and meanwhile, like, I'm trying to be a kid. I'm just trying to do taekwondo. I'm trying to do AP classes and college classes, and I had a job throughout all of this, so there's a lot of pressure on me to be a healthy kid, even though I wasn't a healthy kid. I wanted to do all of these things with my life, and I was just determined to not let these factors get in the way. But eventually this pain was just like, it wasn't just circumstantial.
Unbearable.
It was chronic. It was happening 24/7, and I was active. It's easy to say that chronic pain is caused by inactivity, but I've never been inactive until I was forced to be. So that started. Finally, a doctor just diagnosed me at 16 with juvenile onset fibromyalgia. And that seems like a trash can diagnosis, but there's actually a ton of research on what fibromyalgia is. And then years later, I got a confirmation from another rheumatologist as an adult that fibro was a factor. So that was just early. Those were just early factors. Eventually, the migraines turned into brainstem migraines.
Mm-hmm.
And that is just when the activity for the migraine happens at your brainstem. So this was at the point that I was a veterinary assistant and I was working with horses. And that was like something I really wanted to do with my life. And then I had to stop that because I was going completely blind with these migraines. They were happening bilaterally. So it was, I had to drop that job at one point because of that was going on. And all of this happening, and I guess like this realization happened earlier on that I needed to get healthy and do as much as I could to research. So I started lifting weights right after Rhiannon was born. So that would have been, I went vegan for a year at that point because the pregnancy was so hard and I gained so much weight, and the chronic pain was just really bad. Migraines were bad at that point. So I had started, I had a friend that helped me out and wrote workouts for me. Shout out to Devin, if you're listening. I know you're, I've seen TikToks and stuff, so I know that he's still doing fitness stuff out there, but he was the inspiration and he really helped me out when it came to getting a start at the gym. Nice. And I got a passion from it from that point. He was like a friend from high school.
Yeah.
And then, so after the migraines happened, I lost that one job that I really liked. Then I started having stomach issues.
Mm-hmm. GI issues.
Yeah, horrible GI issues. There's a history of gallbladder problems in my family on my mom's side.
I don't know what this guy is.
Go ahead and let Surfs out. Oh, no. He's wrapping himself up in the cords. Oh no, so I had stopped working with horses at this point. I started all of a sudden having all these really horrible stomach issues, and it was pain. I was getting like sharp pains. I knew it wasn't my appendix. I had appendicitis when I was pregnant with my daughter, so they removed my appendix when I was pregnant. Mm-hmm. And just add on to the list of things. And it ended up being my gallbladder, but it took them a year to diagnose me. So I had reached like this super low BMI, and I just remember being helpless and not being able to believe the audacity that some of these doctors had, because I'm 5'7", and at that point I didn't have a ton of muscle on my body yet. So this is more recent, Yeah. I started a bulk in 2022, and this was happening around 2019 to 2020. Mm-hmm. So it was all happening around the pandemic at the same time, which is probably why it took them a year to diagnose me, because they really didn't want to take any voluntary surgeries, and it became non-voluntary. It became dangerous when they finally figured it out. It was about a year after I started having symptoms. I was 115 pounds maybe at 5'7", and comfortably I should have been at 125 probably. Mm-hmm. For like the amount of muscle mass that I had now, or had then compared to now. But there was one doctor, I went in complaining because I couldn't even keep fluids down. Mm-hmm. And I was like, this was an ER doctor. I was like, man, I can't keep anything down. I'm losing weight. Like, I have never been this skinny. I'm at an underweight BMI. And he just started joking with me, and he was like, well, shouldn't you just be happy that you're not fat? And it's like, you're a medical professional making comments about my body, and I'm literally, like, it feels like I'm dying.
Yeah.
And truthfully, like, that's exactly what was happening. I could have. By the end of it,
Oh, yeah,
when they...
it was going septic, right?
I was at risk for going septic. By the time that he had removed it, the surgeon came in and he was like, I'm really glad we found this when we did, because your gallbladder basically was no longer there. It was fully necrotic and completely falling apart, and he just described it as being absolutely disgusting.
Yeah, that's gnarly, man.
So I had this organ that was literally dead inside my body, and doctors telling me that I should just be happy that I was skinny, which is just abhorrent to think about. So, like, I struggled there, and then I bounced back, you know. It's just like, the thing that I will say is that I always do my best to bounce back no matter what's being thrown at me. And then I'm having crazy symptoms just from there on out. It's gotten harder and harder, you know, up until this point in time. So 2023, yeah, up until just about a month ago. 2023, well, shoot, let's say there was 2021 or 2022 that they checked for endometriosis, diagnosed me with adenomyosis instead. So there's another medical issue that's compiled onto that, and they tried to medicate me for it. They gave me a depot shot, and it messed my system up. And then around that same time, I was also diagnosed with bipolar 2 disorder, which probably had a lot to do with the hormonal situation I was in. You can manage bipolar well or poorly, you know, and it was a really scary diagnosis. It's a mental health diagnosis that is stigmatized big time. And for me, it was categorized as just this horrible level of depression and fog and low motivation, and then every once in a while I'd have a hypomanic day and I'd charge through, clean the house, and just like get stuff done. And I never really fully understood whether or not I had bipolar, or if it was just a product of me being chronically ill and then having good days here and there. But the depression part of it makes me believe that, well, now that I am better, now that I'm feeling better, I actually do believe the diagnosis. I've kind of changed my mind on that from just denying it.
There are a lot of misdiagnoses out there.
Absolutely.
As well, that you gotta, like, kind of watch out for, because a lot of times too, and something that you've experienced was being told that anxiety was the issue.
Oh my gosh,
and
that's what
like,
every doctor will say.
Yeah, and that's just a misdiagnosis. It's just like, I mean, that's basically them just saying, well, we don't really know and we don't really care to find out, so anxiety, here you go. They were gonna put you on some medication that was like blacklisted, you know, because they're like, well, you got really bad anxiety, so like, here's something that you know, here's this anxiety medication that's like really not good. And the thing that we've come to realize too is that any of the medications that, you know, they did a trial and error on just wasn't good. You were taking these migraine preventatives, and the one of the side effects could cause migraines.
Could cause more migraines. It's
like, good lord.
so part of the health struggle was coming off of these bipolar medications, and I was also in just like this super traumatic situation in life. Like, I was in this horrible relationship at the time, and that had a bigger impact on my mood than anything else. It was just I had no sense of safety, I don't think,
Well, and then
pretty much my whole life.
and then you get gaslit when you're in these types of relationships. You get gaslit into thinking that like you're the problem, and there's something wrong with you, and that's why you can't handle the person that you're with. And it's just like, no, there's something
it's
wrong
you.
with the other person.
Yeah. No, it was just like a very angry place to be in. Like this person was always angry. Like literally, I don't think this person was ever happy. So it was an
Yeah,
environment in which I was constantly in fight or flight, and then I was being put on like these really hefty medications, and they just numbed me out, which made
that's
that
all they
situation
do.
tolerant, you know?
It's you putting a band-aid on a splinter, and or that's what the doctors do. Like they're just like, okay, well, I see that you have a splinter here. I'm gonna give you a band-aid. It's like that doesn't necessarily, yeah, and I'm not saying that it doesn't do anything for everybody. Everybody's brain chemistry is different. Everybody's going to respond to different things in different ways, and sometimes people need things like, the problem is there's a lot of over prescribed medications.
Absolutely.
Like some people need morphine. Some people are dealing with like that much pain where they actually like need that type of stuff. um, and it really helps them, but it's just over prescribed, and that's why we have like this huge opioid crisis.
Absolutely. And people
you know
getting hooked on that feeling because it's like, let's say that you're dealing with a really difficult life, and then something crazy happens to you, like you break a bone,
yeah,
or something, you end up in an ER, they give you morphine, and then you realize that that is the first mental release that you have had in a decade. Is just like, oh wow, I love what this did for my mind. I'm at peace right now, and that's how
mm,
you get hooked on the opioids, because it's like it's an escape from that real life, and it's
yeah,
really dangerous.
yeah, no, exactly. And like there was me, you and I were together, and we had like a really good relationship. So doing being to the point where you could get yourself off of the things that no longer served you, or might not have even served you to begin with, was um it was a huge stepping stone. And part of the reason it was doable, or part of the reason that it was like more easily doable, was because we have like a really supportive partnership, a really supportive
Absolutely.
relationship. Because it would have been a nightmare to try to get off of that. If you were in this kind of toxic relationship where you're being gaslit and told that you need it and all
I
this
was
other
constantly
stuff.
being yelled at and stuff like that. So that was a huge positive, was being able to get off of all these medications that I was told that I should have been on. And then right after I'm like off of these medications, my health really starts to plummet again. And I think that part of it was, my body recalibrating again
Mm-hmm.
to being not on the medications. And I just did a genetic test very recently through sequencing, and we're not sponsored by them, but it was a really cool test. I was able to see which medications my body will and will not respond to well, and all of the medications listed were medications that I was put on for
Yeah.
bipolar and for RA, and that was the next diagnosis that I received in 2023. It was rheumatoid arthritis, and that was scary, like I felt my hands starting to change. I'd never had issues. I've always had joint pain, I've always had chronic pain, but it never reached my hands until this point in my life,
Mm.
or my knees. And so that was kind of scary, and that brought me to a rheumatologist, and I got that diagnosis. And then they wanted me to be on medications at that point. And those ones, I didn't accept any of the heftier ones, but I did try what was the malaria drug?
Oh, I have no idea.
I'll have to remember. It starts with an H.
Yeah.
Yeah, I can't remember exactly what it was. It's not a super hefty medication, but it works in some people. It didn't work at all for me, so I ended up not taking it, and then eventually I got off like the really low dose of the migraine preventative that they had me on, which is like a previous antidepressant. So it was finally like when we moved in here about a year ago was about the point that I was finally off of all of the medications that had been put on.
Yeah. Well, and then the the seasons the seem to play a role too, because it was you in the fall time, it would be in the fall and winter, it would be your heaviest kind of like downfalls in terms of health, and then in the springtime you kind of bounce back for like maybe 2 or 3 months.
Absolutely.
I mean, not
into
like,
the summer usually.
yeah, not like fully, you still had to deal with like certain things, and whatnot, but that played a role. And then the most recent thing was just randomly, like just out of nowhere,
This was
just getting seizures, and we are trying to figure out whether they were non-epileptic, seizures, or epileptic seizures, and based off of, everything that, all the symptoms, and the just monitoring them and seeing what they looked like, kind of pointed more towards epileptic seizures.
the patterns, and even the neurologist was stating, we never ended up getting the EEG because I figured it out, but so I think the first seizure that I had is what they were calling a TIA. So in 2023, in September, I think I really did have a migrainous stroke.
And okay, yeah, I was gonna say, just a TIA is just like a mini stroke, basically, right?
Essentially, yeah. So I think that, and I didn't go to the hospital. This is one of those instances I probably should have. But it was like the worst migraine of my life. Severely, like, I don't think you were there for this one. It was me and my mom. She was taking me back from El Paso.
Okay, I was gonna say, I thought you did go, unless I'm thinking about the TIA.
That was in December.
Yeah, but you had another one before that?
I think so.
Oh, I see. Okay.
So I don't know for sure, but I've had migraines my entire life, and like severe migraines my entire life, and this was something that was completely different. Like, it was a migraine, but it was like a migraine on steroids.
Yeah.
And I was driving, and
okay.
yeah, I wanted my mom to come with me because I was having a lot of migraines during this period of time, and they were the brainstem migraines, and they were able to tell through an MRI because that's where all of the scarring was. For my migraines was on the brainstem. So I had taken my mom with me because I was afraid that I would have a migraine in the middle of driving, and surprise, surprise, we almost got into this like huge accident. If like there was like a semi truck involved, and I can't remember exactly what happened, but I managed to brake in time and we were safe, and it was just a close call, and it was a scare, and I think it just scared the crap out of me, and then I felt everything going numb. Like, I felt it, like, especially my right hand, was like the first thing, just like went completely numb, and then I saw like the vision was starting to go wonky. Classic migraine symptoms. I pulled over, had my mom start to drive, and then it turned into, like, I've slurred speech before with a migraine, and I've mixed up words and had a difficult time, but this was like,
it's different.
This was way different. And then I was like throwing up nonstop as soon as we got home, and I took way longer to recover from this one. That was when derealization started. That was what triggered an 18-month long depersonalization. So I think that one may have actually been a migrainous stroke. I was taking a migraine medication that was apparently not good for people with brainstem migraines because they're vasoconstrictive. I was taking what was it called? Rizatriptan.
Mm-hmm.
And you're not supposed to take those with brainstem migraines. Most doctors miss the fact that you're having brainstem migraines or that they're bilateral, and they don't quite understand. So you just get, the migraine treatment that works for most people, which is rizatriptan. It works really well in a lot of people. And so I was taking them like candy because I was just constantly having migraines in this phase of time. But if you take those and you have that kind of migraine, it can give you strokes.
Mm-hmm.
So it's like one of the dangers of that medication. So I think that's really what happened. But I think my first seizure is when I was hospitalized in 2023, and they thought that I had a TIA, and I never would have thought at that point in time that I was having a seizure because I didn't know anything about seizures then, only what you see on TV.
Yeah.
Where
like
it's
the
just like
convulsions and all that stuff.
yeah, they're just like classic symptoms, but seizures, there is a whole spectrum of what even just epileptic seizures can look like.
Could be
And
zoning out, could be all the way up to convulsions.
absolutely, like they're usually focal. And I remember in that hospitalization in 2023 that the paramedic was trying to get me to sign something, and she handed me a pen and my hand was stuck in this claw. And this was after the event that I had that had the ambulance pick me up in the first place at the house. I'd already recovered from that incident, and then all of the sudden my arm's doing this and I can't grab the pen, but I can still talk to her.
Yeah.
So I would have never thought that was seizure activity, but it was only happening on one arm. So I'm like, oh my God, this is a stroke. And then they couldn't find any evidence on any imaging. So what they do is say you had a TIA. They're like, you had some kind of brain event. It was very apparent to us, probably just a TIA. And this doctor, because I got transferred to a different hospital, and this one doctor was just like dead set on believing that it was anxiety above everything else. And I don't know, like an anxious person wouldn't stand up and face like somebody in that position of power and tell them that they're wrong. And I was doing that the entire time with this doctor. I was like,
Yeah.
no, I am not an anxious person. Like maybe a few years ago I had a little bit of anxiety, but I've made myself a little braver. And I wasn't feeling anxious in that moment. I was feeling like mad because this guy was trying to tell me that this very real neurological symptom that I was having was just nothing but anxiety.
Well, and a lot of it, part of it too is because like they're not neurologists. Like they have no idea.
This guy was though.
Oh, you're talking.
I'm talking about Dr.
Are you talking about in the El Paso hospital? Oh, he was
Yeah.
Oh, I didn't know he was a neurologist.
Yeah, it was him and that other dude.
I thought he was basically like an ER doctor.
No, I was admitted at that hospital. I wasn't in the ER because they transferred me from Alamogordo to El Paso. So I was actually admitted in this hospital, and I saw the head neurologist, and then the guy that I'm thinking about, he wasn't the neurologist. He was the gosh, I can't remember exactly what his specialty was, but it was related. But
Okay.
the neurologist was in the room with him, and he was also just as arrogant.
Oh, well, and I remember that because that was in December of 2023, right?
Mm-hmm.
And I remember that because there was that same day there was a grappling competition in El Paso, and I don't remember exactly, like I was running off like 4 hours of sleep. I was constantly like talking to your mom, and like I had to like I think take Aiden to El Paso and myself so we could compete, and then I brought Aiden back to Las Cruces to get something, and then took him down to Alamo to stay with your parents, and then I drove back up to El Paso to see you in the hospital, and I was running off like 4 hours of sleep, and that particular competition, my opponent didn't show up. I had no opponent, and it was American Grappling Federation. They told me they could just like throw me in the challengers division or whatever. And I told them, I was like, well, unfortunately, like I have to go. Like I have someone in the hospital that I need to go hang out with. And so they just like refunded me or whatever, or gave me credit for the next like AGF competition to sign
Yeah.
up for. So yeah, I remember that was like that was a crazy time, and then we ended up like going back to your house. You were walking with a cane for a couple months, and then you ended up like kind of like getting like better, and then you weren't walking with a cane like after a little while, uh and then you were pretty good for a little bit, and then yeah, just like randomly started having what we knew were seizures just in like July of this year, right? And then you had them pretty much like
Oh,
it was like
every day.
it was like every hour of every day.
It was getting pretty bad. I remember the first time I noticed was like towards the middle to end of July. I took a nap on the couch and I woke up with sleep paralysis.
Mm-hmm.
But it wasn't like normal sleep paralysis, cuz normal sleep paralysis you're still just kind of like you're here and it's scary and it sucks, but I was bent over backwards. Like the pillow that was like that I had
Oh,
my head on was my head was no longer on it. It was past it and I was stuck.
yeah, you're like the girl in the ring.
Yeah, no, like all these positions that I was getting stuck in and that I was waking up,
They're
and it
kind of
was
gnar.
terrifying. And non-epileptic seizures don't usually happen in your sleep, so that was one of the signs. And we also noticed that it was very catamenial, so I was way more likely to have more frequent and more severe seizures right before my period,
Mm-hmm.
and maybe within the first couple of days. So that is something that is also consistent with epilepsy and not with like functional neurological disorder. And like these seizures were only happening for 2 to 3 minutes at a time. Sometimes they would cycle, and they
They'd cycle for a
all,
while.
yeah, sometimes it would be like 10 in a row, and I was just getting useless. It got to the point that I had absolutely no quality of life. There was this constant cloud where I couldn't think. So, like, I'm getting recertified. I was certified with NASM as a personal trainer, and my
Which is
certification. Hmm?
what is an asm?
NASM is the National Academy of Sports Medicine.
Okay.
It's like the number one accepted personal training certification. So if you want to be a personal trainer, you go get either a NASM certification or an ISSA certification. Those are the two that if you walk into a gym and you're like, hey, I'm a personal trainer, those are the two certifications that will,
You're gonna look for.
they're going to think that you're a serious trainer if you got
Yeah.
either one of those, because there's a lot of other companies that will do it, but these are the most serious personal
Well,
training companies. So it got to the point, so that expired in October of 2023 actually, is so that wasn't a time in my life that I was gonna recertify, that was when I went into depersonalization.
mm-hmm.
That's when I was like hospitalized at the end of 2023. And then I didn't get out of depersonalization until February of this year. It was the day before Aiden's birthday,
Mm-hmm.
which was like insanely cool. Or was it the day before Valentine's Day? So 2 days before his birthday.
Yeah.
I came out of depersonalization, and that was just mega milestone. I thought that everything was gonna be cool. That was it. Like
And then it just
the issues were over.
well, and a lot of times what happens too, and you know this well, is that like when you go through traumatic experiences, and especially when they're severely traumatic, your body holds on to those traumas, and it can unleash in like certain ways. So it's almost to the point where it's like, okay, well, like why were you? And I struggled with this too, because I'm just like, well, you know, when you were in these like relationships that were not conducive for your health, like for your mental and emotional health, and physical health too, because you're in danger. um why is it that now you're in a safe place that you're getting these seizures? And then it's almost kind of um counterintuitive, because it's just like, okay, well, like the the safety is what's causing it, because it's causing your body to release all this stuff, when you're in a fight or flight situation and you're not allowed to relax, your body is like, we don't have time to release. Like, we need to just survive, and we need to figure out, what's going on. And one of the things that, like, I didn't know how to deal, because I'd never experienced it before. I've never experienced or been around anyone that ever had seizures, and I would try to talk you through them. I would try to get you to breathe. I would try to get you to, like, I even got you to play a song one time. I was just like,
The
I was like,
first half of the seizure, I was still playing guitar.
yeah, and I was just like, dude, like, play me a song, and then you, like, played it, and, like, it ended up being, like, perfect. Um, and because I've seen those, like, videos where, like, people, like, they'll get like Alzheimer's patients, or, like, people with dementia and stuff, they still remember how to play music for whatever reason. Like, it's just really, really, really good for your brain. So I thought that would help. And then we went and saw your naturopathic doctor, and then shoot, I was like, because I took video and stuff too, just to show what was happening. And then I showed her, and I was like, so my question is, like, what can I do? Because I've been doing this and I've been doing that. And she's like, you're doing too much. Like, you need to just chill, just let it happen, play some meditation music, and just check to make sure that, like, you're comfortable, and you're in, like, comfortable, and you're in a non-dangerous position. You're not gonna fall off the bed or anything like that. And then there are times where you, like, just collapsed in the kitchen, and I'm just, like, standing there, and, like, as you're just kind of going to the ground, I just, like, catch you, and then just guide you to the ground. And so it was real interesting. And if you ever have to, and hopefully you don't, like, whoever's listening, but if you ever have to be the person that's not having the seizure, but you don't know what to do when you're with a person that is having one, meditation music, and just making sure they're in a comfortable spot. Like, whenever you would have one, the kids would get worried, and I'd be like, just bring her a stuffed animal, dude. Bring her a stuffed animal.
That was the sweetest thing.
Bring her a pillow, bring her a blanket, make sure she's good. And then every single time you'd have one, like, they would bring you a stuffed animal, they'd bring you a pillow, they'd bring you a blanket, we'd make sure you were good. And it's just really crazy, because you were set up, because we got to the point where we went to the ER 2 times in 1 week, once on a Monday and once on a Thursday.
First time the ambulance, like, came and picked me up. No one else was home, and it was the most severe seizure I had throughout this entirety. I was like face flat into the floor, thinking that my life was over. Like, it was one of those. And it feels like a near-death experience, is what it felt like.
And the ER didn't really do much, but they aren't there to fix the problem. They're there to stabilize you and then send you on your way, or get you signed up to talk to a neurologist, or a specialist of some sort, depending on what you're dealing with. And we ended up going to a neurology place, a sleep center in El Paso, and they were going to set you up for, like, a week-long sleep study, like a 5-day sleep study, where they were going to hook you up to all these, like, all this monitoring equipment. They were going to watch you. They were going to, like, check brain activity and all this stuff. And then we looked into, and you had already done some previous research on this, but ketogenic diet. And then we had you were on this ketogenic diet for maybe like a month before we had the checkup.
Oh, just 2 weeks.
It was 2 weeks.
It was only 2 weeks in.
Yeah.
So I had, like, done some research for a project at one point in college, and I had remembered that they were using the ketogenic diet on epileptic kids in the 1920s. And just like the neurologist was telling us, there's not a ton of research on what the ketogenic diet can do, what a medical ketogenic diet can do for somebody that has adult epilepsy.
Mm-hmm.
And I would speculate, because with this genetic testing that I got done through sequencing, I was able to see that there was a genetic factor when it came to epilepsy, being prone to having epilepsy and having seizures, and it has something to do with the sodium potassium pump. And for some reason, they just don't study it as much in adults, but they were studying it in kids. They were giving kids this diet. They're getting a lot of success in it. But there has been failures with adults that have tried epilepsy. So my only theory...
You mean keto?
Yeah.
Oh, that's like,
I know what I'm talking about.
I was like, I don't know if it's the people trying epilepsy.
Trying keto with epilepsy. It's, I think that it's because epilepsy is caused by multiple things. So in my case, I have a genetic form of epilepsy. And in other people's cases, sometimes you can get epilepsy because of a traumatic brain injury or...
I have a friend like that.
Yeah, so with those kinds, it might be a little bit different, but maybe the ketogenic diet works different or works better in people that have at least this specific genetic epilepsy.
Yeah, and it's kind of nuts, like, that it happened as quickly as it did, because we had talked about it, and you're like, well, I'm gonna, like, kind of phase in, because the other thing is your body's already going through so much that, like, sometimes you just don't want to shock it by just like cold turkey going. And the good news is you were already eating a really well balanced diet, so the transition wasn't going to be as gnarly as someone that's constantly eating McDonald's and Wendy's and, you know, all this junk food all the time. I mean, you had to give some stuff up, you know, obviously, and at the end of the day, it's like asking yourself the question. It's like, yeah, I have these comfort foods, but if these, you know, specific foods are contributing to my health decline, you know, is it worth it?
Yeah, exactly.
Or should I try to find alternatives?
Well, and that's been a journey that I've had forever, you know, since adulthood, at least, since I've had Rhiannon, because that's when you take life more seriously, you know, in your health. And that's when I started to notice that it wasn't going to be easy for me. Like, the health problems were never going to be made easy. So I've tried everything. I have read all these different books. I've tried different protocols. I did vegan for a year, and it didn't work. Not 100%. I got healthier, and I think that's because of, like, the incorporation of super whole foods. But I tried literally everything, and then I got really serious about it, and I started getting inspired because I was making a difference with weightlifting. That is the other thing, is just, like, diet, huge portion of what it has taken for me to make a difference in chronic illness. But one of the other big differences is that I protected myself from a lot of this. A lot of this could have been way worse. The rheumatoid arthritis could have been way worse.
Without the weightlifting.
Recovering from seizures and my ability to walk. Huge difference is the fact that I was weight training for 10 years and, like, really seriously more since 2021, I think.
And even, like, for myself, like, I've dealt with injuries, and the reason I'm able to bounce back from those injuries quicker than, like, someone else might be is because, you know, I'm constantly feeding my body the stuff that it needs in order to be able to recover. So if I'm, you know, I've torn ligament, I talked about this in the last episode, but I've torn ligaments in both knees. You know, I've tendons, I guess. Would a tibia be a tendon?
I'm sorry?
Would a tibia be a tendon?
That would be the bone itself.
Oh, really? Okay.
Yeah.
So, but I could...
There's a tendon that's going to be attached, though.
And that's where the tear happened.
Yeah.
Because you can't tear a bone, right?
No.
Okay.
But you'll have tendons that are... So tendons and ligaments attached, like, your muscles. So one of them attaches muscle to muscle, one of them attaches muscle to bone.
Yeah. And the more that you feed your body, I don't know as much about tendon tears, but I know, like, with ligaments, like, there's there are things that can inflame. So if you're eating sugars, like refined processed food, refined sugars, all these additives and all this other stuff, like they increase inflammation in your body. When you increase inflammation in your body, it slows down the healing process. But when you're eating foods that are meant to repair your body, and you really treat food as a medicine, it's phenomenal. Because I mean, if you think about your whole food sources, they're going to be either plant or animal based, right? But they're not going to be like some weird, like some weird thing that was processed in like some chemical factory, or putting petroleum based products in your potato chips. Like it's not going to be something like that. And so when you think about it, like anything that's like plant based, like that's what drugs are derived from. So you have something like aspirin, which is just a synthetic compound of salicylic acid, which is something that occurs naturally in salix trees and willow bark. So people, traditionally would like scrape some willow bark off and chew on it when they had a headache. And or even like melatonin in cherries, like that's really good for headaches as well.
Valerian's another one they used to make Valium
Yeah.
for anxiety and stuff.
So like anything like that is going to come from like your natural sources. And so when you fuel your body correctly, and everybody's body needs different stuff, but I will tell you that nobody's body needs fast food.
Or alcohol.
Or alcohol.
That's like a promise. So your body does not need either of those things, and neither does your mind, and that's what tells you that you think you need those things as a comfort. And the way that I look at it, because you were saying like food is medicine, right? If we're looking at food as medicine, you're gonna need a different prescription for every person. Your anatomy is completely different than mine. It's everything that your body is going to need is going to be completely different than what mine needs. So it's like my body needs a different prescription, a different food prescription, and that's how I try to think about it instead of thinking about the comforts. Because like I had air popped popcorn every single day. That was one of the few joys that I had in life still, because my quality of life was so diminished. That was something that I looked forward to every day. It's just like, at least I can lay here and eat my emotional support popcorn, and it was every single day. But that's not something that I can have in my carb allowance for my body to work. So my body does not work well on a high percentage of carbohydrates. It works well under ketosis. So there's really healthy ways to do this. And for me, I just keep my carbs under 8%. Some people it's more strict. They keep it more towards like 5% or lower, but you find what works for you. And I find that like as long as I stay under 10% on the carbohydrates, I'm really okay. I try to keep it to like 5 to 8%. I have my bowl of berries at the end of every day, and it's enough because my quality of life is better. I don't need a bowl of popcorn every day to make my life feel like I'm happy.
Well, and you have to listen to your body too. And your body's going to tell you what works and what doesn't, and your body will adapt as well. So like with me, I quit eating, like, I mean, every once in a while, like I'll slip something in there, but it's the refined, like added sugars. And there was one time where like my body was just so like used to not having these sugars, and then, but I was craving, I was craving something just like disgusting, right? And so I went and I bought one of those like Texas like Cinnabon things, and man, I had like a really bad migraine like the day after eating it, and it's just because my body got so used to not having the sugar that it doesn't know how to respond to it, so it responds to it as a toxin, because like all of my other sugar is going to come from fruits, and things like that, but hardly ever any added sugars. If there are added sugars, it's very, very minimal, and it's like straight up cane sugar, and that's it. No high fructose corn syrup, no, any of this
It's
other.
honey, it's agave, it's
Yeah.
regular cane sugar. It's natural sources. Dates have like a good
Yeah,
natural
figs and
sugar
things like
source.
that. So I guess to circle back around, like that was what was preventing you from getting onto the mats in the first place. And
Absolutely.
yesterday you were able, because you were coming like as you started feeling better and being able to go to more jiu-jitsu competitions to watch, and things like that, you started coming to the dojos on Saturdays so you could watch the kids, and then we could film content for the Seed to Strength page, like the tutorials and things like that, right? And then you decided yesterday, I saw you going with the gym bag. I was like, are you gonna step on the mats? And you're like, yeah, I think I might. We'll see.
We'll see how I feel.
It's like,
I was
okay.
coming up with like every excuse in my head. It's just like, well, my lower back's really compressed today. I've got nerve pain in my legs. Maybe today isn't the right day. Maybe I shouldn't do this today. And it comes down to movement also being medicine, and that was what I convinced myself is like I'm
Yeah.
always going to have a reason. It's going to be hard to start. It's going to be hard to get on the mat.
You gotta choose your hard.
And
like
that's exactly what it came down to. I had to choose which one was gonna win, and the chance to get better comes with movement.
Well, and then like and I'm not saying like you did this, but a lot of people have this mentality of I'll try tomorrow. I'll
Mm-hmm.
get on tomorrow. I'll get on next week.
It's easy.
I'll start at the first of the year. People want a starting point, and it's like no, the starting point is now. Like if you ever feel, I mean, like obviously there are times where you just absolutely could not do it, obviously, right? And
Yeah.
you know that, like, and that wasn't like an excuse.
That's knowing your body.
It was like, well, I'm having seizures. Like I'm not gonna be able to get on the mat and do anything. Like that's a
Well,
legit reason. And some people are just like, well, like they don't have the legit reason. They're like, well, I want to lose weight, but I don't want to give up my fried foods.
and that's why I think that losing weight, especially just for aesthetic purposes, I don't think that that's enough. I don't think that that's enough of a goal, because
Unless it drives you.
for most people it's not. Like in my experience as a personal trainer, simply wanting to look a certain way isn't enough motivation.
Do you think that there's a difference in that perspective between males and females? Or do you think it's pretty across the board?
Actually, you know what? I feel like there is. I feel like in women we want it because there is a pressure to do so.
Well, societal pressure.
There's a yeah, and it's a pressure because your friends look a certain way, or maybe the people that you follow on Instagram look a certain way, and you have a
Yeah.
hard time feeling good about yourself unless you look a certain way. So, and even in male clients, because that does come up as just like, I want muscles, bro. I want to be
Mm-hmm.
big. I want to be large and in charge. I want to look good. And that is a very powerful motivator for men. And it's almost like the environment in the gym for that reason is a little bit easier for men, because there's a lot of support. And honestly, that's the thing about gyms, is that 99.9% of the time, as scary as they look from the outside, your hype people are going to be in there. Like, you show up
Yeah.
to the gym regularly, you start to get to know the people that go in at the same time as you start to get to know the staff.
Mm-hmm.
They get invested. All of these people get invested in your progress, and then it doesn't become about looking like the big dog. but that's how you communicate. That's how the guys all
Yeah.
communicate with each other, you know? It's just like, hey, how's it going today, man? Ah, nothing, just trying to look like you, brother. Like those are my favorite interactions because it's so supportive, and women don't always have that same comfort level in the gym.
There might be a well, I guess with either there could be like a jealousy factor, and jealousy is like one of those weird emotions where it's like it's not good unless you let it fuel you. Like you should never I I believe that you should never compare yourself to another person. You should just compare yourself to the person that you were yesterday. But if comparing yourself to someone better than you, or not necessarily comparing yourself, but you're like looking up to that person,
That's different.
then that's a motivational drive to be able to like actually accomplish that. But again, like motivation comes and goes, and it's really all about discipline, and you're not going to be able to have the look and everything that you want without discipline. And for me personally, like I wanted to feel better, like it's not fun to, be out of breath walking up a flight of stairs. It's kind of brutal. So I wanted to feel better, and at this point, like I do take like the after gym pics, and I do like look at the development in the mirror, and it's not to just like, you know it's not to like gawk at myself or anything like that. It's basically just because like I'm proud of the progress that I've accomplished, because the physique, it doesn't lie. It's just like that's 100% hard work.
Yeah,
And like,
absolutely.
you know um
Well, and that's a really good example is that we've trained you in the gym. And this is honestly a good topic for next time is like what we did in the gym to get you ready, like go into
for
more
the cut,
detail
yeah.
on the 8x8s versus when you're not cutting. But we should have grabbed pictures from your
Oh,
cut, and we'll do that next time. We'll put them up on the screen next
well,
time. But you're shredded, dude. Like you're absolutely shredded, and in like an aesthetic way, like you look good, but you look good because you trained with a different goal. So I think
yeah,
your body, and I think that this relates to energy too. Your body is going to respond to energy. And how do I put that in better words? Like when you are more inspired by feeling a certain way and by healing yourself and putting that work into yourself, I think that is like the definition of loving yourself. It's not like
yeah.
I love myself, so I'm going to take a bubble bath. That's self care. Like, no, I love myself enough to tell myself to get up and go do what I have to do when it's the hardest thing that I'm going to do today.
Well, and not only that, but like you gotta love the people that you are supporting as well, because one of the main things is just like one of the reasons that I decided to give myself a better lifestyle. The last time I smoked a cigarette was 2015, so it's been a decade, almost 11 years of having not smoked a cigarette. And Aiden was born in 2016, meaning that his mom was pregnant in 2015, right? Because he was born in February, and that was the moment where I was just like, man, this it's not about me anymore. It's about
Yeah.
the life that is about to be brought into this world that I'm responsible for. And my dad died when I was 18 years old, and like that was devastating. Like that just destroyed me. I mean, like it destroyed me, but it also motivated me to become like the best person that I could be.
It
You know,
rebuilt you at the same time.
yeah. So it could be like, okay, well, like if he's, if his spirit is around and he's watching me, and like I can either be, I could disappoint him, or I could make him proud of like the man that I became, right?
Yeah.
And part of that comes from you know losing a parent when you're that young. um, you don't want to put your kid through the same thing. It's just like,
No.
man, because I mean, Aiden's 9 years old, you know, Uh, nine. Well, he's almost 10. So, in 8 years, I'm only gonna be 42, 43 years old.
Yeah.
That's not a good place to leave the earth, you know. And my dad was older. He was in his 50s, but still 50s is young.
It's too young.
It's super
Yeah.
young, and so you have to remove the selfishness when you realize that it's not about you anymore.
It's been a huge part of me too, and how much work I've put in. It's like if there was a mystery, in which my body's been a mystery to me this entire time up until this point, and
Yeah.
I have nonstop done everything I possibly could. Like I got certified as a personal trainer just so I could know everything.
Yeah.
And that certification, that paper, it doesn't mean hardly anything unless you get the experience in the field. And I had an amazing person to shadow. I actually have like a picture, so we'll run through. So like just a little like recap actually, to circle back before we end. I have fibromyalgia, a history of really severe migraines, rheumatoid arthritis, no appendix, no gallbladder, uh, seizures. Am I missing anything?
You had seizures.
Yeah, like this is all the stuff in my history.
Yeah.
Bipolar 2 disorder. That's all these things in my history, and these things have affected me literally my entire life. Like I
Yeah.
struggled from the time that I hit about Rhiannon's age, just a little older than her,
Yeah.
is when I started to struggle. And it wasn't just the seizures that went away.
Yeah.
Like that's the crazy part, is like if it was just the seizures that went away, it would be worth it to eat this diet, but it was so much more than that. There's like been a cloud of depression and low motivation that has been sinking me down since I was a teenager. And
Just lifted.
it lifted literally within weeks. The amount of motivation I have, I feel like my eyes naturally sit more open than they did before. I feel like I was always just like constantly exhausted and dragging and unable to think. So I wasn't able to do like the personal training certification work because I couldn't concentrate. I could barely get Rhiannon through school.
Yeah.
And I could barely walk from one room to the other. So that's where I landed, is not being able to walk, hardly from one side of the house to the next without losing my breath and getting dizzy. And then 2 weeks later, no seizures. And like nothing, none of the symptoms or all the other symptoms starting to fade away. Like I'm not 100% better, obviously. Like I still have struggles, but I've never had hope that I would have a normal future of any kind.
Well, and then the next week too, like we discussed the getting onto the keto diet, and this episode a lot was about previous health,
Yeah.
struggles and stuff like that. We didn't talk about what the day-to-day of the keto diet looks like, so that's one thing that we could touch on next week. And then a second thing would be we can discuss becoming a martial artist with the handicap that I have when
Absolutely.
it comes to being born with a club foot, and we won't go into all that detail now.
Also climbing mountains. Like there's...
Yeah, so we can go into all that next time. But I think those would be good topics.
Yeah, good stuff to go into. So these black belt pictures are going to come up again, but I'm going to go to this slideshow here. I said stop. Okay. Maybe, if it'll allow me to. There we go. It's going to play the other one in the background. Okay. So there was the hospitalization. This is after I gained a bunch of weight and I was still tired. This was me with my training guy I shadowed, I gained a lot of weight here. This is when I was working as a personal trainer. All of these ended up out of order. But yeah, I'd ended up like being a trainer. We'll do that one more time so I can explain better. So yeah, 2023 when I was being hospitalized, this was around that same time. Well, this is when I was a personal trainer for the first time. And this is a more recent picture of me. So you'll see here, like, I had gained a ton of weight. I wasn't looking so hot. And this was prior to that. And then this was way before I put on muscle as well. And I'd ended up being able to put muscle on again, like a good substantial amount of muscle. I was able to lose all the weight because I gained like it was like 30 or 40 pounds when I was like on all of the medications and like dealing with the health struggles. And then you'll notice like my hair changes because I had to shave my hair twice. Like that was part of the struggle.
Just falling out.
It was falling out, and I think it was because of the medications that I was like having to get myself off of. So there was a period of time that my hair was falling out when I was on them, and then it was happening again as my body was readjusting and I had to shave my head again. That's an entirely different experience, like especially as a woman, having to lose your hair twice. And I just turned it into a spiritual experience. You know, they say that hair holds memory, and when you shave your head, it's like you're giving yourself a brand new start, a fresh start at life. So it was I made it a positive thing, and my hair's come in healthier than it's ever been in my life. That's another thing I'll notice from the keto is when I started doing keto. It's been about a month now, more than a month, and my nails have never been this strong or like shiny, durable. There's so many things I'm noticing, like differences in my skin. I'm sitting at 140 pounds, which is heavier than I would normally sit. But the RA was starting to get me like losing weight again prior to me starting keto. So I was starting to like lose muscle mass. It was eating away at muscle. And so like I'm still sitting at a good 20% body fat, which is great for somebody that's not like super athletic at the moment.
Yeah.
And my body is bouncing back in ways that I never thought I would see. And it was just one dietary shift that happened to be right for me that gave me a quality of life I never thought I'd have.
Yeah. I just heard kids.
Yep.
But yeah, that's I think that's a good place to end it. Again, like if you know, we'll go into more detail on some of this stuff. You know, and hopefully we can inspire some people to like really try to change their lives, you know, no matter what they're going through, whether that or what their journey looks like, whether that be weight loss or wanting to learn self-defense, or you know, if they have some kind of medical reason why they need to start trying to get into fitness and eating properly. And if there's any advice that is needed from the audience members, then you know, drop a comment, let us know. We can talk about like really whatever in terms of like health, fitness, and martial arts in general. But we'll dive into that next week. And it was kind of like a celebratory episode too, because like you were able to get back on the mats yesterday, which was really fun.
Yeah.
And really just really cool.
And it ended up being okay, you know, at the end of it.
Yeah.
I talked about symptoms that I would usually have when I would do any kind of endurance, like massive headache and stuff. So I was just expecting to feel badly afterwards, and I didn't get anything more than a minor headache, you know, and like a little bit of fatigue afterwards. But like the bit that I feel today, honestly, is just muscular
like
soreness. It's like something that anybody,
just normal,
you know, anybody would feel. And this isn't to say that we're advocating that everybody with a health problem go jump on and get a keto diet started, but it's more meant to inspire the fact that diet and movement are the best prescription, whether that means keto for you or paleo or Mediterranean. it looks different for everyone, but if you're struggling with similar issues as to what I was struggling with and you haven't tried it yet, then that is an option on the table. But we can talk about all kinds of diets and we can compare and contrast. Like, if that's something that you guys want to hear more about, we can definitely dive in on the nutrition.
Yeah. But for now, we'll sign off. And yeah, just we got all our socials up there, so be sure to follow. We have YouTube and all that other stuff. It's not just Twitter and Instagram. So find us at Seed to Strength MMA. Just search that in any of the socials, and you're bound to find us.
Yeah, we're there.
So, and stay tuned for more podcast episodes, more technique breakdowns, more shorts.
Nutrition tips, and eventually, as I'm doing more gym work, there's going to be a lot more strength training tips on the page as well. So we've got a lot of striking and grappling up right now, but we'll have a lot more nutrition and other athletic tips. I plan on diving pretty deep into the strength training for jiu-jitsu competitors and for MMA competitors.
Yeah.
So there'll be a lot of content on that in the future. But for now, thank you for listening in if you made it this far, and we will see you next week.
All right, see you later.